my pleasure to be speaking with Ruan Cox Jr. from Regeneron. It's no coincidence that Valentine's Day falls as well in February, as well as Black History Month, and we're going to be delving into, of course, appropriately, specifically heart health and breaking those barriers within heart health, and talking about navigating the disparities and honoring the contributions that African Americans have been contributing, again, in this specific area of the industry. Ruan, thanks so much for coming on. Welcome to the program. We'd love to hear a little bit of a background about yourself before we sort of dive into the questions.
Thank you so much for having me, and I really am honored to be able to present today at today's symposium. As far as my background, it's really, I've dedicated my career towards research partnerships, enabling science to be able, and art and research and development to continue to grow through the formation of different partnerships, whether that be in academia at Moffitt Cancer Center, or in industry at Regeneron Pharma in the Regeneron Genetics Center. So, my ultimate goal is to enable research partnerships such that R&D can take place, such as the interaction between academia and pharma can lead to novel discoveries that can push fields forward.
That's terrific. Thanks so much. And let's dive right into it. And let's talk a little bit about the major challenges that are facing heart health today and how those challenges are disproportionately affecting underserved communities from your perspective.
Yeah, I think, the landscape of heart health today is marked by several significant challenges. I think, and the pandemic has made us all too much aware of this. The rise in lifestyle-related risk factors such as sedentary behavior, unhealthy diets, tobacco use, and other high-risk behaviors contributes extensively to the prevalence of heart disease globally. Additionally, there's an alarming increase in the rates of obesity and type 2 diabetes. And in combination, this diobesity concept, which are direct risk factors to cardiovascular disease. And I would say along with that, another big risk is that the fact that we have an aging population. As our life expectancy increases, so does the prevalence of these heart conditions, which necessitates more complex and long-term solutions, having more individuals involved in the care and individuals from a provider standpoint. Moreover, I think there are significant challenges in the public health domain, including disparities in terms of healthcare access, healthcare trust, the need for improved patient education, and the integration of advanced technology and heart health management that can be available to all communities. I think these challenges are further impacted and compounded by the current healthcare infrastructure struggle to adapt rapid changes in all communities and the needs of every single distinct population, especially our more marginalized populations.
Yeah, absolutely. Absolutely. Can you provide some examples of some of the health inequities that we're seeing currently in the healthcare system?
I think underserved communities bear a disproportionate burden of heart health challenges kind of due to systemic inequities. Mm-hmm. These groups often face higher exposure to unhealthy environmental conditions, such as pollution, limited access to safe areas for physical activity. Economic disparities result in poorer dietary options and reduced access to healthcare services, leading to higher rates of untreated or inadequately managed conditions like hypertension and cholesterol, which are precursors to heart disease. Mm-hmm. And additionally, on top of some of these disproportionate things, there are cultural and linguistic barriers that impede effective communication between healthcare providers and patients, which leads to lower rates of compliance, lower rates of understanding, and that all results in lower treatment and application of preventative measures. I think these are some instances, not just in terms of the access, but also in terms of the understanding gap that exists between communities and our healthcare providers.
Yes. Yeah, no, absolutely. I think some of the audience here might not have sort of the cardiological background, that you might have. And we often bat around the term social determinants of health. I'd love to hear from you about sort of how those social determinants actually affect heart health specifically.
Yeah. Social determinants of health, such as education, employment, income, housing, have a really big impact on heart health. Educational level, for instance, influences health literacy, and it affects the individual's ability to understand and follow medical advice. Employment and income levels are another thing that dictate one's ability to afford healthy food choices, gym memberships, or even basic healthcare services. Housing conditions can influence heart health through exposure to pollutants, lack of space to exercise, or stress from unsafe living conditions. And we're really just now on the forefront of understanding how the mental and stress related issues affect you from a health related standpoint. Additionally, there are other things like neighborhood factors, like availability of fresh food markets, for instance, and community support networks that are playing critical roles in shaping lifestyle habits related to health, heart health, that people in these communities may not have access to.
Yeah. Yeah, no, totally. It's good to be able to sort of see it from all those different sort of lenses and the different sort of factors that affect heart health specifically in that sense. Bring it back to the month of February and talking about African American figures in in the field of heart health specifically. We'd love to hear about some of the figures that you've researched and gotten to know, and how honoring those specific contributions that those pioneers have made actually help in advancing health equity.
Yeah, there are several, beyond several African American figures that made groundbreaking contributions to heart health. Daniel Hale Williams, who performed one of the first successful open heart surgeries, paved the way for future cardiac procedures. Vivian Thomas's work, despite facing racial discrimination in her field, was instrumental in developing the surgical technique used to treat blue baby syndrome, which is a syndrome where the baby's not getting enough oxygen, so they take on this blue color. Dr. Levi Watkins revolutionized cardiac surgery through the development and successful implantation of surgery through surgery through automatic implantable defibrillator. Sorry. And then there's Regina Benjamin, U.S. Surgeon General, who advocated for preventative health measures that directly impact heart health, such as smoking cessation and obesity reduction. I think when you think about these successful figures, it goes back to the adage that if you can see it, you can be it. And so when you see folks in your history books, when you see folks in your textbooks, or you see folks that have their picture on the wall where they look like you, then you're more inclined to believe that you can be one too and be part of the representation that makes the trust easier, and also that there is an underlying will and desire to provide adequate healthcare to these communities, no matter what you look like.
Yeah, I think really, really important points to highlight, and some really important trailblazers to also highlight that maybe some of the audience might not be aware of. So definitely, you folks out there who are watching the program today, do look some of these African American figures up who have really pioneered a lot of these innovations in technologies that are now affecting the advancement of both health equity and heart health. Ruan, thanks so much for coming on the program. I'm sorry we didn't get to absolutely everything. Those of you in the audience, we have put in Ruan's LinkedIn information, so do connect. I do encourage everyone to connect with him to carry on this important conversation. And Ruan, we hope to have you back on the program again, and thanks so much for your time today.
No problem. Thank you so much for having me.